Let me know when you're ready, Alan.
You are good to go, Senator.
Oh, okay. Well, welcome everyone. This is the monthly meeting on the commission to study PTS in our first responders. I have a script that I need to read, so I will go ahead and go through that. Welcome. I am Senator Regina Birdsell. Today we will be meeting for the Commission on PTS for First Responders. Before we get started, I'll read through a checklist to ensure that the meeting that we are holding is in compliance with the right to know law. As chair of the PTS Commission, I find that due to the state of emergency declared by the governor as a result of the COVID-19 pandemic, and in accordance with the governor's emergency order number 12, pursuant to executive order 2020-04 and its extensions, this public body is authorized to meet electronically. Please note there is no physical location to observe and listen contemporaneously to this meeting, which is authorized pursuant to the governor's emergency order. In accordance with the emergency order, I am confirming that 1, we are providing public access to the meeting by telephone with additional access possible by video and other electronic means. We are utilizing Zoom for this electronic meeting. All members of the committee and selected legislative staff have the ability to communicate contemporaneously in this meeting through this platform. And the public has access to contemporaneously watch and or listen to the meeting on Zoom or on YouTube, and via phone by following directions and links provided on the General Court's website. We have provided that the public notice of the necessary information for accessing the meeting in both the House calendar and the Senate calendar. We are providing a mechanism for the public to alert the public body during the meeting if there are problems with access. If anyone has a problem, please email remotesenate@leg.state.nh.us, or you can call 603-271-3043. Number 4, in the event the public is unable to access the meeting, will be adjourned and rescheduled. Please note that all the votes taken during this meeting shall be done by roll call vote. And finally, let's start the meeting by taking the roll call attendance. When each member states their presence, please state where they are and if anyone else is in the room with you during this meeting, which is required under the right to know law. Before we take the roll call, there's a couple of things that I'd like to do. One, I'd like to have, since it is 9/11, I'd like to have a moment of silence for 9/11 in honor of 9/11, and also for Liz Sargent's husband, Edward Sargent. If everyone is okay with that, we'll start the moment of silence. Okay. Russell, would you like to lead us in the pledge?
Yes. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Russell.
Thank you.
So with that, I will go ahead and take the roll call. Representative Mark Prue. Okay. Representative Fred Davis. Representative Timothy Susi, he is not here, unable to attend. Rudy Ogden, but I know that,
Lexi Rojas, present.
yep.
On behalf of.
Great, thanks, Lexi. Christian Citarella?
Hi, here, and I'm in Concord at my office, and others may stop in from time to time, but otherwise I'm alone.
Okay, great, thank you. Jason Henry?
Here in my office, again, same thing. People might stop in time to time, but I'm alone.
Great, thank you. Robert Buxton is unable to attend. Scott Naismith? Scott? Okay. Jeffrey Stewart?
Good morning. I am here in my office. People will probably stroll through periodically in Concord. Other than that, I'm alone.
Thank you. Jared O'Connor?
Hi, I'm here in my home in Nashua,
Ah.
and I'm accompanied by Henry.
Okay, great. Thanks, Henry. Russell Conti?
I am here. I'm at my residence in Concord and I am alone.
Lisa Dravick?
Good morning. I'm here at my residence in Londonderry. I'm alone in the room, but my 2 teenagers are home doing their remote learning today. So hopefully I won't see them during this.
Okay. Ken Norton?
Hi, Ken Norton from NAMI, New Hampshire. I'm in Pennacook. I'm currently alone. There may be other family present, but not in the room later on.
Great. I believe David Goldstein is not here, but Dan Poirier. How do you pronounce that? Poirier?
Poirier.
Poirier?
I'm present. I'm here for Chief Goldstein at Franklin PD, and I'm alone. And others may walk in at some point, but I'm alone.
Great, thank you. Gordon Wilson?
I'm at my home in Brentwood, and I am alone.
Great. David Witham is unable to attend. We also, if I understand, we have Detective Justin Breton from Manchester PD. He's the coordinator of Southern New Hampshire team, attending via Zoom. Detective, are you here?
Yes, good morning, everybody. I'm here. I am working from home in Concord. My family is out of the room, but they're also doing remote learning. Chief Goldstein asked me to attend. Unfortunately, he had to attend a funeral this morning.
Okay, thank you. With that, we do have a quorum. So do we have to take a vote to accept the roll call or no? We do. Okay. So we have to take a roll call to accept the attendance. Do I hear a motion?
So Jason Henry, I'll make a motion, accept the attendance.
Thank you.
I'll second that, Jeff Stewart.
Great, thank you. Do I have to take a roll call for this too?
I think you're good. I think usually the roll call at the beginning would be to accept minutes. Once you do the roll call, I think you're all set, Senator.
Okay, great. All those in favor, aye.
Hey,
All those against, nay? Okay, so the attendance is here. Has everyone had a chance to go through the minutes? Do you feel the need for any changes?
Jeff Stewart, make a motion. We accept the minutes as published.
Okay. I'll go ahead and second. And we need to take the minutes. I mean, we have to take a roll call for the minutes. Oh, I forgot to say I'm here, by the way, for the attendance. So Lexi.
Yes.
Okay. Christian.
Yes.
Okay. Jason.
yes.
Jeffrey.
Yes.
Okay. Jared.
Yes.
Russell,
Yes.
Lisa,
Yes.
Ken, Ken,
Muted.
he's shaking his head. I'll go with that.
Yeah, he needs to.
That was a yes.
Okay. Lieutenant Dan Poirier,
Yes.
Gordon Wilson,
Yes.
and David Witham. Oh, sorry, he's not here.
Senator, I think you forgot Scott Nismith.
Oh, sorry. I have him here is not here. Is Scott here? Ah. Oh, okay. Sorry, Scott. Are you a yes on the minutes? Okay.
That's fine.
Okay, and I will vote yes. So with that, we have accepted the minutes. I think the next thing we have is, did everyone get a chance? Oh, sorry. What?
My apologies, Senator. Just for the minutes, the purpose of the minutes, is Mr. Naismith present, yes or no?
Yes.
Okay, I'll correct my notes. Thank you.
Yep. Sorry about that, Lexi. So with that, did everybody get a chance to read the notes that I put together for the report? One of the things that I want to do is I reviewed it last night, and I think the first thing we need to look at is what kind of legislation that we think we need to put through. The first thing we need to do is, I think, extend the commission. Does everybody feel that way? Okay. I was going to try and have a conversation with Representative Prue as well to see what he thought maybe what we can do. Did anyone get a feel for what type of legislation we might be able to put through, or should we hold off until the next commission? Because we didn't really get a full feel for, we didn't get a full year in the study commission. Some of the things that I looked at that we could somewhat study is more training for peer counselors, try and get more peer counselors in, but that's not something that we would do legislation. One of the things that I also looked at that Representative Prue had delivered is a requirement that first responders are notified or make them aware of the psychological hazards that they face and the resources that are out there. So maybe once a year, some of the things that we used to do at Raytheon when we wanted to notify all employees, once a year put in their paychecks information on PTS and what a number that they can reach.
Senator.
Yeah.
This is Jeff Stewart. One of the things might be, since we look at annual required training that most of us are required to do on a variety of subjects, from sexual harassment, workplace violence, et cetera, maybe there's some way we could tie an awareness level of stress on the job or something to that effect as part of the annual educational requirements. And then that still gives each individual agency the flexibility to meet that goal however they need to. Some will do it online, some will do it, in an operational meeting, some would do it in a roll call meeting, however it is, but at least once a year, and then it's tracked. Just a thought. And I don't know if we could legislate that or follow those use those sexual harassment / violence in the workplace requirements, that verbiage, and maybe copy that or duplicate that into something here in New Hampshire.
That was kind of where I wanted to go as well. The only concern I would have is the cost to the municipalities, and if it would cost any more, bringing someone additional in. Does anybody have any input on that? Is there any?
Yes, Senator, it's Russ Conti. Just a couple of thoughts. I think the peer training, the suggestion for peer training is excellent. And I think as far as mental health stuff goes, I agree with Jeff. And I think what he's probably mapped out is something that's relatively no cost at all, depending on how it's delivered. And with the Department of Safety, we have, if everybody knows the term Moodle, there's a way to deliver stuff online and to get people to training. So we have a couple of mental health Moodle modules that we use. And then I just put a note out to the Department of Safety, to the state police, on just a reminder, which is very much in line with what you just said, that's done in private companies. And that's commonplace now, just of what the resources are, what to look for. These are what's available to you. So I think annually, I think it's easy to do. And I think Jeff and there may be suggestions from other panel members, but it really is, it's a no cost item. It's just a matter of kind of getting it out. It's an information sharing. If you want to make it, more formal and have a formalized briefing at a roll call or an annual, inspection, however you want to do it. But I really think that is really a low or no cost item. I don't know how you can legislate it, but I think the suggestion is there. And I also will tell you that based on, much of what I get for input it's the need is there also. So there's people are very interested in this, not just people on this panel, but people that have not given this a lot of consideration in the past. And given the fact that, we're in a position to give it, the exposure that it needs. So just a couple of suggestions.
Senator, if I may, along those lines, if we utilize the Department of Safety / Moodle or Noodle application, that would also include our volunteer and our private, because volunteer or on-call fire services still have access and utilize that system, and volunteer and privately paid EMTs and paramedics are also covered through the DOS licensing process and would have access to that modality. So I think that might be the way to go, and we include everybody. We don't just isolate to public employees only. This would be cross-functional.
So, Jeffrey, what you're suggesting is anyone who's listed as a first responder, whether it's, the contracted EMTs or the dispatchers, if they contract those out, that they also be required to give the annual. Okay.
Yep.
Okay.
And I think by going through DOS, that would include some of our emergency dispatch personnel as well.
DOS. Okay. I would probably need to connect with the commissioner of DOS and see how he or she or he would lay this out and get the word out. There's no one on municipal. Is there anyone on? Oh yeah, Lisa. Do you see any issues with from the municipalities on cost if we put it into an annual training for these first responders?
I don't think so. Thank you for giving me the opportunity. I don't think so, because I think between Primex and perhaps being able to tap into the Department of Safety through our our PD and even our fire department, I think that's something that could be done for little to no cost, if at all. Even through our EAP program as well, through Health Trust. I think there's a lot of avenues for delivery.
Okay. Are you all required to have, let's say, sexual harassment? Okay, so that can actually be included in there, and just bring maybe the peer counselors or however they decide that they want to do it in to discuss. Now, do you all do it on the same day? or what I mean is, like, let's say, Jeffrey, you go to your training, is everything done for you on that one day?
No, it would be agency dependent. So our
Okay.
agency might spread it out over the month of September. I've got 4 trainings I have to complete during that month or that quarter.
Okay.
You know, and if we're doing it online, there might be more flexibility as opposed to we actually scheduled in-person classes, physical in-person classes, and it's going to be agency dependent. But I think to the Major's point and Lisa's point, if we capitalize on some of those internal systems that are already there statewide, we reduce costs dramatically, and it just can become one of those annual type, not dismissively, but one of those annual, like, yes, it's that time of year, we upgrade on our sexual harassment, we upgrade on our workplace violence, we upgrade on our PTSD or stress-related awareness, however you want to phrase it out.
Do we think that this should be put into legislation? That is required? Is everyone through legislation required to do the sexual harassment and other trainings? Okay, I'm getting a no and a yeah.
Yeah, it's a certification requirement, Senator. So if you look at law enforcement, I'm sure it's the same with the fire service, EMT. There's a certification you hold with the state. And in the case of the police, law enforcement is done by police standards and training, and then it's mapped out. You have to have a certain amount of hours of training. And by the way, that is going to be changing based on the Transparency Commission. I know there's probably going to be an increase in the training hours where this actually fits very well.
Yeah.
So that's kind of how it plays out. I'm sure the fire service has something similar, emergency medical technicians, emergency dispatch personnel. And the only other suggestion I'll make is there really is a mechanism that we're using to cross over all first responders right now, and that's the Fire Academy. And the reason that we started looking at the CIT training, the Crisis Intervention Team training, is because of what Jeff has said, what Gordon's involved in, and that is because there is so much in the fire service, and I didn't realize this, so much volunteer, so much remote stuff, that there had to be a way to get people involved and get them to associate with it because they have other jobs. So that, I will tell you, that's worked very well. So not speaking for Director Pendergrass, who's in charge of the Fire Academy, but we have crossed over in using their resources to schedule our classes. So when you're looking for a class, whether you're law enforcement or fire service or EMT or communications, you would schedule through that. So just a suggestion, it could be a mechanism that's in place that works well. And obviously the fire service is part of the Department of Safety. The Moodle does not belong to any one division. It's part of the Department of Safety. And the commissioner has there's an IT department. So again, I agree with Jeff. I think it could be pretty seamless.
Okay. Russell, I might get back with you on this one-on-one just to kind of go through the process so that I can, with Representative Prue, and maybe Representative Susie. Anything else? I mean, I've got a few things that, one of the things that I was when I was looking through the meeting notes, a number of our speakers actually, they all pretty much had the same suggestions. And I think Mr. Multi, is that how you pronounce his name? Multi? And hold on. He had it broken down really well as far as the following things to change or address. And his is, and that this was kind of an underlying, I think, underlying piece in the whole is the culture. While we've made some improvements, I think there still needs to be some culture change so that individuals can openly address these issues. He also said the well-being of the force. The well-being of the force for the first responders needs to be made a priority, and this is one of them. and removal of the stigma and access to assistance. So with that, I was going to use a lot of that in my recommendations, including the annual training for recommendations on what needs to change. Some of these, obviously, what he put there, we can't legislate, but we can strongly recommend that the organizations do kind of a culture change and take the stigma away from PTS. And we keep stressing that. And it's getting better, but we have a ways to go. The other issue, which, first of all, does anyone have any other comments?
Senator, I do.
Yeah.
I think that that culture change is going to start in I'll speak for firefighters at the fire academy. If we can get the newer members to kind of embrace this behavioral health and wellness, it'll naturally change through the culture. I mean, the culture we're battling now are people with 25 or 30 years on the job that it's never been a thing. Mm-hmm. And that's kind of the battle there, getting them to accept that. But I think if we start with the newer, younger members coming up through, and I think that should start probably at the fire academy and integrate behavioral health training into firefighter level 1 classes. So, and that would reach out, that would get everybody, that would hit all the volunteers. It would hit everyone that is looking to go full time. You would, and kind of continue that. I think that's going to be the way to change the culture.
Right, because we may not be able to so much change the more experienced
it's
people.
A challenge. How's that?
Well, it always is. We're always kind of set in our ways,
right.
But you can always change from the newer members, and that kind of goes into the rest of the organization. So.
With that being said, I've had several conversations with Scott Robinson out of Rhode Island, mm-hmm. and he started the Warwick, Rhode Island peer support team. He said 15 years ago, and he was running against the same things. It was the kind of the pushback from the membership, and he said now 15, almost 20 years later, people are actually they're giving them a hard time if somebody's not there as something's happening, as an incident goes. So I think that they've had a huge culture change down there, and I think that I don't see why any of us couldn't have the ability to make that change. But like I said, I would go back to like when people first join, it'd be the police department or the fire department or getting a job as an EMT. I think that initial training is the place to start.
Okay, I agree with you, because I think it's easier to put it in their heads when they're younger, and it gets embedded in.
So Senator, if I could just add just a couple of comments. I couldn't agree with Gordon more. However, I am gonna say this. I am one of those dinosaurs. For me. And I'm going to tell you that equally as important is the top-down approach and the buy-in, because what happens to young, first responders, it doesn't matter where you enter, is they come into a culture, and that culture has ways of pointing them in different directions. And the one thing that all first responders want that's universal, I haven't met one yet that didn't say it, is they want to be backed. They want to feel like somebody has their back from the top down. They want to feel like if I get into a tight situation, or if it's something about my family, that there's not going to be somebody at the top that looks at me differently. I think they're so worried about their peers as much as they're worried about who they work for. And I think one thing that I think we've made a tremendous change in overall, and I can't speak for all first responders, but I can certainly speak for a lot of them, is that especially in my age group, there's a recognition. There was absolutely nothing when I started. And that's one of the reasons that I am privileged to give back. But I think, you have to do it. It's got to be top down and bottom up. You know, new first responders get a lot of training, and they have ideals that are absolutely incredible. They're very well educated. They're very in tune to what's going on in society. And that's wonderful, but they all work for somebody. And it's really got to be also at the top. And I've talked to a lot of senior people, and you know, they can be resistant, but I share my story. And if anything else, they can relate. They can relate to my experiences. And anytime, you know, I'm asked, why would you come back and do this? And I said, well, that's the question. It's the perfect reason why. So I think it's got to be twofold. And I think we have to also, you know, and I would make a suggestion also to bring senior leadership into the room. And I have over the last, you know, couple years, seen a lot of senior leadership that's made some true changes, but I also know that there's pockets out there that they haven't.
Well,
You know, mid-level people. So I think that's also part of it. I just want to make sure we mention that for all the old guys in the business. So,
well, my recommendation, I mean, our recommendation should be from the top down have to be trained. It can't be just the mid-level on down. It's got to be required from the top down. And at some point, some of this hopefully will start kicking in even to those that are not as accepting. Before I forget, I found the other one. It's Ms. Davenport highlighted a number of things, and which kind of coincided, Ms. Brown and Ms. Davenport, they all coincided with Mr. Multi. Ms. Brown, her suggestions was changing the climate and conversation to destigmatize education inclusive of resilience training. So I think we've talked about resilience training. And then she says, warm hands off so that individuals are offered peer support upon entry into treatment. And then promotion of wellness and self-care and crisis cards that are offered to employees that they have access to a point of reference, which will help with the annual training, I think. And Ms. Davenport came up with very many of the same recommendations. So I was going to use those as kind of a template for our recommendations as far as the PTSD or PTS commission. And I was going to, I think the piece of legislation, and you can add to all of this, but the piece of legislation that I was going to put in is to extend the commission and to require certification of PTS training annually from the top down. Is there anything else as far as legislation that we should add in there?
Senator, this is Ken. Couple comments that I wanted to make. One was that I was on the governor's law enforcement accountability commission, and I'll send the link to people, but there were lots and lots of conversations there about culture, certainly, and lots of conversation relative to training and culture. There were 48 recommendations that are coming out of that commission, and several of them have to do with training for law enforcement around mental health. So I would think relative to legislation, my suggestion would be to not necessarily make it specific to PTS, but to say relative to mental health, including PTS maybe, because I think that there's a number of aspects relative to keeping it more general about mental health that would be important, including suicide and suicide prevention. And then the other thing that I wanted to mention was that there was a bill brought last year separate from this commission, and I think that the sponsor that brought it wasn't aware of the commission and the commission's work, but it was a bill to provide for death benefits for the families of first responders who die by suicide. It was HB 1122, I think. It did have a hearing in the House. Chief Goldstein and I both testified at that hearing. There were a couple work sessions. It passed the House with an amendment, but went on to the Senate. But you know, obviously COVID hit during crossover. It never, I mean, it never had a hearing in the Senate. And I don't know whether we want to separately endorse that bill or a similar bill. I don't know whether the sponsor, you know, is bringing it forward again this year or if somebody else is, but I think it's something that we should discuss as a commission. Thanks.
Are we sure that didn't get implemented? We have so many omnibus bills. I don't remember what went into what at this point anymore. In fact, I was trying to find one last night that I had to make a statement about on clean water, and I can't even find it in the pieces of legislation that we passed. But are we sure it hasn't been wasn't included in one of the omnibus bills?
That's a good question, actually. I mean, I'm looking at, you know, the bill itself says it was laid on the table.
They all were.
Sure. I will look in the one that that included the. There was a bill with some police misconduct pieces in it. That was also an omnibus bill with a bunch of different parts. I'm not sure that it is in there, but I can see if I can find that. I would think that that's where it would be, but it wouldn't, you know, I mean, as you said, I don't know that that's necessarily, so many of these bills were put together. It was hard to tell where things were ending up.
All right. Alan, do you know by chance?
Sorry, can you, what was it, the specific thing we're looking for? I'll try to find it for you.
The bill, there was a bill that was put in, I think, in the House authorizing payments for suicides for first responders.
I'll go look for it.
I think it's life insurance payments for those.
Okay.
It was 1122 was the bill.
Okay.
But I don't know if it might have ended up someplace else.
Okay. I'll go look for it.
Because we compiled a lot of stuff and a lot of stuff.
Yeah.
So let's first check and see if it was passed. If not, then yeah, we can consider something like that. So what we've done is require, so Ken, what you're saying is yes to putting in the legislation mental health and then specify including PTS. Require training, annual training on mental health, including PTS.
Yes.
How does everyone feel about that?
So Jeff Stewart, I just want to toss out two things. I think we need to be clear that the training, there's a difference between training our first responders, police, fire, EMS, dispatchers, et cetera, corrections, training us to be aware of the public's exposure to these, or the public's, or how we may interact with a patient or client or detainee, et cetera, as opposed to the focus that I think we're talking about in our commission is the effects on us. And I think there's a little difference between what I might engage when I'm interacting with a patient or a client from a mental health perspective versus I'm now interacting with a colleague, or I'm sitting at home and I'm now demolished my second bottle of gin and I'm eyeballing my 380. I'm eyeballing my sidearm. And I think there's two different things, and I just don't want that to get convoluted in any of our statements or proposed legislation. Second component is just to be careful on the word certification or certified when we're proposing training, because at least on the fire EMS side, and I'm assuming, so it's an assumption, law enforcement jump in, but there's distinct definitions when it comes to certified programs. If you're a certified firefighter 1, 2, 3 career versus law enforcement versus EMT paramedic. We have, there's definitions on that term certified. So I just wanted to be clear on that if we propose any language.
Well, I think for right now, because obviously not everyone can be trained, or I'm sorry, not everyone can be certified on PTS. So it really has to be, just like with sexual harassment, annual training of, because there is no certification set up at this point in PTS.
Correct. But then I think somebody, I'm not sure who was mentioning, the word certified came out as we were talking about PTS. So I just wanted to be careful on that. That's all.
Okay.
That's just my opinion.
All right.
Yeah, Senator, it's Russ. I agree with Jeff. I was probably the one that said certification. What it relates to in law enforcement, and I do agree, and Gordon can certainly chime in. There's a lot of certifications in the fire service and EMT service. The police officer certification, one, it's universal for all police officers in the state. And what it really mandates is a certain amount of hours that you have outside of firearms training and use of force at another group. So I was thinking we can kind of fit it into that part of it. And so not to make it say you have to have it for certification purposes, because I agree with Jeff. We don't want to make it problematic. Only that in that amount of hours for mental health training, and this would also tie into what Ken said, to make the mental health training something that is part of that yearly, to keep your certification, you go through these steps. There isn't anything specifically you have to do. You just have to be exposed to it outside of the mechanics of certification training. And again, for police, it would be, the firearms training and the use of force and, that type of stuff. So I agree with Jeff. He's right. And I believe I was the one that said that. So I look at it as it relates to law enforcement, but I do realize that there's a lot of different levels out there for first responders.
I can just chime in. It's Dan Poirier. I think the training is huge. You guys talked about the cost from a smaller department and not state police. If we send people to the academy, right now you're mandated 8 hours of training a year. You have to go to some type of training. That costs us money. We have to pay the officer to go, and then we have to backfill their shifts just because we run on low numbers. So I think there's that cost there. But I think the presentation of the material is the most important, because we have the culture of supervisors that have 10 or 15 years on. So depending on how they present the information is probably how it's going to be received. If it's presented, we got to go through this, it's like sexual harassment, just read it, sign that you're ready, you understand it, and we'll do it again next year. So if it's not presented in the right way, then the message is going to be lost. So I think that it should be presented by either at the academy. If it is, then you just have to look at the cost, but I think the cost is well worth it.
Well, I was thinking of a presentation like Representative Prue did that was pretty comprehensive. I mean, obviously he's not gonna be able to do it. Maybe he can do it for everyone, all the trainings, but something similar where it really hits to the core.
And we have, I think there's plenty of options to make it a virtual component. So, but Lieutenant Poirier is absolutely right. There's a cost to smaller departments for sure, and volunteer departments. So even though they're a volunteer department, there's still a budget somewhere the town pays for. So I agree on that. But if we made it more of a online opportunity, at least on that awareness level, or on that quote refresher level, whether it's annually, et cetera. Maybe the initial course should be in person. Maybe that's something they can iron out, or refresher components or follow-up components might be able to be virtual. And I'm sure Mark would be awesome at doing it in his retired years, quote unquote.
That's actually a really good idea. Require everyone to have the first one in person, and then set up a annualized online and then maybe every 5 years have it confirmed in person again. Okay, so we are in agreement that we're going to go ahead and what I'll do is I'll put a draft of the report together with the recommendations such as culture change, stigma, and then I always divide the legislation piece. And what I'll do is I'll put the extend the commission and then do the annual training. But Russell, I'm going to talk with you a little bit in more detail before I send it out so that I kind of get the wording accurate and the try and get the Fire Academy information in there as well,
Yeah, I'm
because
happy.
that's eventually going to have to go into the legislation.
Absolutely.
Is everyone okay with that? Anybody have any
Can I ask just a question, and maybe you were going to get to this? In preparation for this too, I went back to the original legislation creating the study commission and noted all of the, 1 through
10.
10, I guess. Yep. And I know we prioritized those things at one point. Do we need to lay out those same things again, or should we?
Well, I think
some of them and re-emphasize the ones we didn't really get to, or I don't know how legislatively. I just thought I'd ask.
That's one of the things that I'm probably going to do in my, I think I already did it. Hold on. In one of, I thought I put it in the notes, and I don't, doesn't seem like I have them here, but I know in the October, you're right. What we did in the first meeting is we went 1 through 10, and I know suicide was up there, was number 1. That's one of the things that I'm going to put in there, that this is in order of importance. This is what the commission had decided to concentrate on. It might actually be in last year's final report, but I'll verify that. But I'm going to list those and then highlight what we've already covered. And I, compared to what the information that we had throughout the year, we covered most everything, including the suicides. And I think what we've thought about is that the biggest issue is kind of PTS, which is compilation of what kind of causes the suicides. So I think that requiring PTS training annual will help, hopefully, with that type of issue. But I will add the 10 priorities that we had listed. And we may not have gone through all 10 of them, but we certainly got, I think, through the first top 5.
Right. Yeah, my concern was just re-raising the issue of, I know we had, I think it was the last meeting, discussed that now that there's been a little more time, although COVID has taken up much of it, to have some time to study in the future what the costs have been. Have there been more PTS claims filed under workers' comp with the previous legislation, and really get to the heart of the issue of cost and whether there should be a presumption, and if so, how that would work or not work, that sort of thing.
I think if I recall, last month we had agreed to wait until the new commission started, because by then we'll have a little bit more information on the cost and if presumption is helping.
Okay.
So that's something that I will put in, that we'll study on the new commission. But again, I'm going to put it together and I'll send it out. We'll have to agree to a date in October. So I'll get it out to you hopefully about a week before. So before our meeting, and then we can make changes to what we think goes in the final report, because the final report's due November 1st. And unfortunately, it's coming pretty quickly. So I'll add the cost presumption to that.
And Senator, this is Jason Henry.
Yep.
We have same amount of corrections, and we also have academies. This would not be very difficult to add into the academies, nor recertifications. Initial academies, we no cost, recertifications down the road, minimal costs. So it would be a good for training.
Good. So I'll maybe what I'll do is maybe next week I'll try and get Russell and Jason do a conference call and kind of walk through it on how I would put it together for the legislation, and put that and present it in October, and see if we need any changes. Then I can put in some legislation if I get back in.
Senator, that I would like to chime in on that only because that will impact the EMS side of things significantly. Because we, similar to police and fire, have recertification requirements and Con Ed requirements.
Okay, so how would that, you mean using the fire academy?
Correct.
Okay.
We fall under that fire academy, Department of Safety, but the EMS recertification requirements are different than the fire / law enforcement certification requirements. So if there's a change and an adding of hours, that impacts our process and annual requirements.
All right.
Very similar, I'm sure, but
So
it impacts it.
are you in agreement that we should try and add this annual training through the?
Oh, yes, absolutely. And I have a couple of ways we could do it with minimal financial impact, but yeah.
Okay. Oh, okay. So maybe we can do a 4-way call. I'll see if I can get a conference call set up. Maria, are you taking notes on this? Thank you. So maybe we can get a 4-way call between the Fire Academy, Russell and you, and kind of walk through the process, because we may not. I'll walk through the process in the meeting, but it's more important to get the process through in the legislation, because, you know, once you put that legislation in, it's going to be ripped apart in the House and the Senate. So I want to make sure it's right as best as we can before it gets ripped apart. So,
Senator, can I add to that a little bit?
Yeah.
We talked about, like the behavioral health training, awareness kind of training. I think that it would be important to talk about resiliency training. You know, I think that we hit the awareness as people are coming in, but I think that the senior members and going up through as you progress through the job or your time as an EMT, resiliency training is a huge aspect of that.
okay. Yeah, there was a lot of discussion as I'm reading through the report. There was a lot of discussion about resiliency training. So I'm going to see what I can do. I'll add that into the recommendations. Now, Russ, I'll ask you offline next week.
Okay. Yep. I agree with the resiliency, and just so everybody's clear, when we talk about mental health training, behavioral, resiliency is always part of it. It's part of the CIT program and part of the peer program. And I think a lot of this in setting up the peer groups really are the resiliency points of contact. That's really what they are. And when we talk about resiliency, we're also, let's not leave out that that's also a recruitment and retention issue. People come into agencies that they believe, even before they get there, they ask a lot more questions than I did. how they're going to be taken care of when they get there. So I agree with Gordon. I think it's under the big umbrella. And I don't think it should be so broad where we can't get it done. But I think these other aspects that are coming up are important too.
Okay. I thought of something, I didn't write it down and it went completely out of my head. But any other thoughts?
Senator, this is Justin Breton from Manchester PD. Just wanted the commission to be aware, I do believe it's RSA 281A17C that will make PTSD a presumption under the workman's compensation statute. And that should be in effect as of January 1, 2021. I know someone had brought that up, whether or not that had passed. As long as there hasn't been any changes, that should be effective January 1.
Okay, so we won't even know until probably June or July, if then, the cost.
Yeah, there have been some situations in Manchester where cases have been reviewed, but we wouldn't be able to provide any data in regards to that yet, just because that presumption isn't mandatory yet. So some cases are still being reviewed.
Okay, so that's probably I'll still put it in the legislation, but when the commission meets next year, they should put it further into the year that they look at the cost, because it's going to, I mean, if it doesn't take effect till January, feasibly, you'll be lucky to see any impact in it the first 6 months.
Right. And I mean, we'll may be able to get some of that data from Primex, but also the self-insured cities like Manchester. I'm sure they would be willing to come back. I know we had a speaker from Manchester and our insurance provider come earlier in the commission to speak about what the reviews look like for officers going through and putting in the paperwork to be covered. And I'm sure they'd be willing to come back and speak to the commission again if needed.
Okay, that'd be great.
So, thank you.
Any other thoughts? We did send out the letter to our congressional and our Senate, our federal delegation on the coverage under, is it Medicaid? So Medicare. I don't know why. This is why I'm not on HHS. So I'm going to give it about another 2 or 3 weeks, and then I'll try and connect with the federal delegation's office and see where this is probably a bad year to do it because they're in the middle of elections right now. But to me, it's a kind of a priority. So I'd like to see at least where they stand on it. So I'll try and get some feedback from them. Probably I'll try and get some feedback before our October meeting. How's that? Okay.
That'd be good. And this is Ken, and you know, it's not necessarily a bad year because there were a lot of changes through the Center for Medicare and Medicaid Services as a result of COVID about reimbursement and services. So it may be timely in that regard.
Yeah, and one of the things that came crystal clear to me that we do need additional people who are trained in first responders and get that going as quickly as possible. I mean, I say as quickly as possible. It takes a long time regardless, but if we can get even just speed it up a little bit, it would be helpful.
I did get a recommendation about that in the LEAC Commission, the Governor's Commission on Law Enforcement. It was obviously specific to law enforcement, but to talk about 2 parts. One, the need for mental health providers to be better trained in how to provide treatment and support to law enforcement and for their own mental health, as well as better trained to assist law enforcement in responding to mental health crises. So two-part recommendation that's in the LEAC report. And again, I'll send a link to that.
That'd be great.
Or maybe I'll just post it in the chat.
Okay.
Yeah, and Senator, this is Justin Breton again. I had saw in Mr. Norton just brought it up, and I saw it while reviewing your last meeting's minutes. You guys did raise the concern that there wasn't enough training out there for mental health providers to give services to first responders. One thing that just for the commission to be aware, veterans and first responders out of Manchester, they're a mental health provider that I know state police has utilized, Manchester has utilized, and they're actually in the process of creating a training for community mental health providers to be able to enable them to better service the first responder population in our families. So that will be something that will be available in the near future.
What's their name again?
It's Veterans and First Responders Healthcare. And they're right at 1750 Elm Street in Manchester. And just to Mr. Norton's second point, in regards to better training for first responders and peers, we do I consider it that the state was awarded a grant most recently through COPS and the Law Enforcement Mental Health and Wellness Act. We're going to be receiving $82,000 over the next 2 years to be able to better provide training to law enforcement personnel in regards to peer response. So that training will include resiliency, and that will be free to all first responders. And that was something that was just announced last week. So we'll be putting together that program and be able to have more information for everyone shortly. So Chief Goldstein and I can lay that out in a formal write-up for the commission, so that way you guys will know what's coming over the next 2 years in regards to training peers and how to better network those peer teams in some of the smaller communities.
That would be great. Thank you very much. And maybe that's something that we can have you present, you and Chief Goldstein present in the start of the new legislative session when they start the commission up again.
Absolutely. Yeah, we'd be happy to do that.
Okay. Anything else? Okay. We've gotten through, we've reviewed the report. I'll go ahead and I'll, the next couple of weeks, I'll start working on this and get this out to you all. Any other business that needs to be covered? Any ideas? All right.
Do we need to set a date for the next meeting
Yep.
to go over the report?
Yep. Okay. We usually do what, the second Friday of the month? That would be October 9th. Alan, is that available?
It is, yes.
Okay, great.
At 10 a.m., Senator?
Yeah. Is everyone okay with the 9th?
Yes.
Okay, I'm getting a lot of head nods. Yes. So, all right, that'd be great. So I'll have that ready for you on the 9th. Well, I'll try and have it to you out a week ahead of time. I know Marie's good at throwing the whip at me. So, all right. Does anyone, before we do the roll call to end the meeting, does anyone have any other questions, concerns, comments? All right. So do I hear a motion to adjourn?
Jason, motion adjourned.
Okay, motion by Jason Henry, second.
I'll second.
Oh, okay, Gordon Wilson seconds. So I will say yes for adjournment. Lexi? Lexi?
Yes.
Okay.
Sorry. I'm
That's okay.
we're having issues with my microphone again. My apologies.
Christian,
Yes.
Jason,
Yes.
Robert's not here. Scott,
Yes.
Jeffrey,
Yes.
Jared,
Yes.
Russell,
Yes.
Lisa,
Yes.
Ken,
Yes.
Dan Poirier, Lieutenant,
Yes.
Gordon,
Yes.
and am I missing anyone? Did I miss anyone?
Detective Brighton.
Yes.
Okay. All right. With that, we are adjourned, and I will set up some time with Jeffrey, Russell, and Jason for next week on a telephone conference, and then the rest I will see you on the 9th. Bye.
Thank you.
Bye, thanks.
Have a good one.